Let me see. There we go. Okay. Thank you, Mom. Um, so really excited to be back with Pink Table Talk. Really excited to see my co-host, Dr. Candace. Haven't seen you in a minute.
Yeah.
And get us started for the year. And excited to have two special women with us today. One of which, like, lady, I was actually doing an event with her like 2 day a day the day before I had my baby. And so that's funny that like last saw you. And then we'll get to know Brianna here as well, my oldest and dearest friend. But Dr. Candace, let's hear from you this year.
Yeah, I'm very excited. Congratulations, Haley. You have a beautiful baby. She's so precious.
Thank you,
So
thank you, thank
excited
you,
for
thank you for
you.
that, and thank you for hats, because hats really help in motherhood.
I'm Candace Thompson. I'm a breast surgical oncologist in the Bay Area at Stanford and co-host of Pink Table Talk, and really excited to get this year started off talking about how the intersection of caregiving and breast health, especially for Black women. So really excited about this episode.
And lady, would love to hear who you are and how you maybe found touch or whatever is on your mind.
Yeah, absolutely. Hi, everyone. My name is Lady Wadike. I'm the program manager for the patient navigation program for Black Women Thriving East of the River. First, I just want to say congratulations, Haley. Like, I know we literally just saw each other like last year, and then I was like so surprised. You were like, "Yeah, I had the baby the day after." So I'm so happy for you. Congratulations.
Thank you.
Um, and in terms of, what I do in my role, it's a lot of community building. It's a lot of really connecting with people and knowing like what their questions are about navigating a cancer diagnosis or even trying to figure out how they can find screenings and making programs to kind of answer those questions. So happy to be here today with all of you and happy to be a part of the discussion.
Thank you.
Yes, and then we have my, again, oldest and dearest friend, Brianna Bingham. If you've watched Pink Table Talks before, you've probably seen her sister, Jada Blair, who serves our Young Ones Advisory Board. Bree inherently serves on every board, being that she is my best friend because I ask her questions all the time. And so, Brianna, who are you and what do you do?
Well, hi everyone. My name is Brianna Bingham. I'm happy to be here and to join you all for this discussion. Caregiving in general and just working with older adult populations is something that I have really enjoyed, and also just have personal experience with caregiving for my grandparents. Currently, I'm a third year medical student at Howard University College of Medicine, so I'm just grateful to be able to speak with all of you all and just learn more about how I can improve just bedside manner and just be once again, I think just be there for just our family as they are aging, and I'm happy to be here. So thank you.
And
Yeah.
congratulations, Brianna, to making it
Thank
to third
you.
year. I know
Thank
it's
you.
a lot of tests and everything to get
It's
to that
going.
point. So congrats.
Thank you. No, thank you. And also thank you for your help as well and support.
Of course.
Yeah, no, it's fun to build these connections because we get to like support each other at the various parts of their goal to or their however method they choose to do this work, right? And so thank you guys for being here. To everybody on the East Coast, from the Midwest, from kind of the West, like if you are a part of this storm right now, please stay safe, and stay hopefully inside. Hopefully you have what you need to do that. I begged Brianna to come to my house and chill here during this storm, but she is independent and I um but no, so just to like again ground us in Pink Table Talk, it's been a minute. And so this show is truly here to talk to young Black women. It is, we are Touch the Black Breast Cancer Alliance. We do everything Black breast cancer. But this show, and with this show, we try to breathe that preventative piece, right? Talk to young women about the things that they should know at this point in at this point in their lives about their Black breast health. I think that, you know, if we've talked about so many different topics that affect Black women. And this week, we really want to focus on that caregiving piece, patient rights, understanding what that looks like. I think when I think about caregiving, I immediately am like, oh, I think personally about all the parts in my life that this comes up, this topic comes up. And then also on the larger scheme in our work with breast cancer, how we are caring for you know, women affected by this disease. And so just a couple of stats, right? Because we want to ground us in some knowledge. Approximately 1 in 4 of Black adults in the US provide unpaid care to a family member or friend, right? I think the words that come out to me are unpaid. Um, you know, that being 1 in 4 Black adults. And some people are forced to then leave work because they cannot do both, right? Um, and then I think about, how often we're not like doctors. I know that I'm not. So, like, being a caretaker, am I actually the best care for my person? So, there are so many different thoughts that come up when I think about caregiving. Um, and so I would love to check in with you guys all personally first, right? What does caregiving look like in your family? How is that working? I know that, Bree, I thought about you because you just shared you had just been home and taking care of your family. I know that unfortunately my grandmother, who's 92 and, lived an amazing life, is kind of in and out of the hospital at this point in life, and that kind of sucks. And it puts a lot of stress on my mom, and to have to run to the hospital to be there. And there's just like we've worked so hard to find out what like care would look like for them as my grandmother is 92, my grandfather is 94, and it's such a blessing to have them. And yet, like, it seems like we haven't yet figured out the best way to be there for them, right? And the best way to like I mean, I feel like we have the best. We have, someone that comes every day and support that comes at night even, but it's still so hard to figure out, right? And so I know this affects all other families. So please go ahead, anyone who wants to share what's happening with caregiving in your family personally, if you don't mind sharing.
Yeah, I can start off. So I've been like caregiving on and off for both my grandparents since like 2017. I've been fortunate whereby, um, you know, I was living on the West Coast for a while, but during holidays, breaks, things like that, just to help out. Also I love my grandparents. They are, even though they had both of them, well, grandfather passed away, but he had dementia. My grandmother currently now has dementia, but they're still very, they're mobile, independent, but also need to be able to have their meals prepared and to bathe and to also just make sure that, that they don't fall and things like that. But for me, it like was meal prepping. It was also just spending time with them, like taking them out to get like pedicures, manicures, things like that, but also making sure like, granny or papa, like, what would you like to do today? Like, how are you feeling today? Are we, do you feel like being around people and like making sure that they can like have a say in what their day could look like? Um, Also, having to worry about, um, you know, they feel like a burden sometimes, and that's something that was really difficult for me because it's like you took care of me, like this is the least that I can do. But also there are times whereby we have like medical aids, but also my grandparents grew up in a generation whereby they're not like, for people who they aren't familiar with, it's kind of tough for them to, they might not want to be touched. Or also when we're thinking about nurses who speak different languages and having to also navigate that, I just we're finding a balance, but I feel like the biggest thing is making sure that they have autonomy and they can say, I'm not really feeling that free, or,
That autonomy piece is unreal because it's like they're also like old and like, and we're talking about grandparents we're in this moment about caregiving.
yeah,
It's like that's like, yeah, like they don't want to be told what to do. They told you what to do. Like it's just that
yeah.
it's a lot to take in.
And no means no, and it's like, okay, no worries. And also like they have feel like they're very aware even with cognitive decline, like they're not, they have superpowers, I don't know. And so but that's just kind of been my experience. But I think now as things are becoming, they're in and out of the hospital, at least my grandmother is a little bit more often, that's where it's like, okay, it can't just be aunties and uncles, like we need people who can kind of look out for certain things. Um, yeah, that I might pick up.
Yeah,
Yeah,
I
I
definitely
can.
agree. No, go ahead.
You can go, lady.
Okay, I was just gonna say I agree. And just to piggyback off of that, like it really takes a community to be caregiving at this point because caregivers need care too, you know? You can't really pour from an empty cup. And so just reflecting on some of my roles as caretaker, I know I was really helping my mother with her mother a couple years ago, and she has since passed. But managing another human being who has thoughts and wants and needs is very difficult, you know, and sometimes they don't necessarily, at least in my grandmother's case, didn't really understand what was going on, you know? So there's a lot of physical caretaking that people kind of think about, but there's also a huge emotional lift as well that may go unnoticed until it's time to exhale and you're like, oh, that was a lot, you know? So, it's just bringing back memories from that and being able to like lean on that community and use the resources in your community that might be available. That's how we navigated caring for my grandmother, and now that I'm navigating caring for, my aging parents. So, yeah.
Yeah, no, thank you both for sharing. Dr. Candace, what about you? What's going on in your fam?
I was just thinking back about several things as far as caregiving goes, because sort of like both Lady and Brianna mentioned, it sort of goes beyond just the physical aspect. There's a lot of emotional and mental aspect to things, especially as a physician. Um, Pretty much every time I see any of my family members, they tell me like ailments that are going on, and then I have to follow up and be like, "Did you check on this? Because we don't want this to get worse." So, like as a caregiver, like professionally, there's always the added sort of
You care
load
for
of
everyone.
trying to make sure that everyone else is taken care of. And it's really important, as Lady mentioned, to make sure that you're taking care of yourself and sort of like decompressing from everything that happens. Because I live in California and I'm from Florida. And my parents are still there. My grandmother's in Atlanta and her sister's in Florida as well, who I'm close with. So like I'm always checking on them, but I'm always from afar. So it's difficult. Unfortunately, they are independent. But I always worry about like whenever it does come to that point, I feel like an obligation to be available and be closer. So there's always like that juggle as far as like trying to balance like work and caregiving. Sometimes you do have to think about your job situation and how you navigate that when it comes to taking care of your family, because that's very important. So I think this is a really important topic that we're covering today. I
Yeah.
guess, oh, sorry, you can go.
No, no, you said the word obligation, and I feel like that
Yeah.
word comes in so intensely in this conversation because it's like, oh my gosh, like, am I obligated to take care of the generation that made me, right? And by that, it's like, what does that obligation mean, right? Does that mean like I'm obligated to like not ever put, I feel like we always have to put you in a home conversation, right? And it's like that's something that Black people don't do, or it's something that like we do, but don't talk about that we do it, you know?
Yeah.
I feel like that's more likely it, you know, because again, like Dr. Candace, like you are a doctor, but still you might not be specialized in the ailment that the old people in your family are dealing with. You know, so like there's a giant gap for those of us who aren't doctors because it's like I don't know what you need, right? And I would much rather put you in a setting where you did have the care you needed, right?
Yeah, I think it's a double-edged sword too towards being a doctor, because
Yeah.
it's like you. as like we know what you need and we'll give you suggestions sometimes and then like those suggestions aren't heeded or
And you're not my patient, so I can't.
yeah. And then you know the other side to things, so it's like you don't want to have them to be seen by others who you are concerned about like decision making on that end as well. So yeah, it's a lot more of a burden sometimes as a caregiver
Yeah.
professionally.
And then it's like what we're talking about, or like in this work, it's one thing. I feel like elderly is a bucket, right? But then you just have like someone that just is dealing with breast cancer, dealing with something, right? And they could be any age. As we know, we're here.
Yeah.
Pink Table Talk exists because breast cancer is getting younger. Black women under 35 are getting it at 2 times the rate, dying at 3 times the rate. You might just be in your 20s and receiving care. You might be needing to see what caregiving looks like from your work from that perspective because you are just starting your career, right? And so for me, when my mother had breast cancer, when she got breast cancer, I was 19 and like, luckily, I went to a school on the quarter system where I was able to take off the quarters when she was home getting chemo and like just went on the other quarters to finish school on time. But like that was something that like I was able to manipulate in my life that made the caregiving that my mom needed a lot easier for me to give. And by that I mean like it's not like she totally, I know she could hear me too, but she totally was like acted, tried to be super mom in those moments. And it was like you don't have to be, right? And so it was definitely an adjustment that we all had to make when she was sick in our lives and make sure that we had the time to be there for her. And but again, she wasn't like elderly at the time, and so we had to like still combine all the life things that are a part of this, right? And her care. And she was one that was like, I don't want to wear a wig during this, and we had to find fun ways to deal with that. And so I now have like a giant hat collection. Like that's where the hat obsession started. So like if you split caretaking for us, it had to be creative. It had to be different because it wasn't like I was taking care of my old grandmother who's on oxygen or whatever. It was like, no, this person's still like enjoying all aspects of life, you know? And so I think that caregiving can look different when it's somebody that's like just, again, of a different age, of any age. It probably all looks different. I now I'm caring for a baby. That caregiving is but like, and probably not that different from an old person, but in ways. But um, but yeah, I feel like it's just, I guess age has a really big component here. And where you are in life has a really big component here.
I think the human aspect, I don't know what it is, but it's really not that hard just to like you don't it doesn't have to be weird. Like what would you like just think about like, what is something that you need on a typical day? Like try instead of like trying to, it's almost like you can have the uncomfortable conversation, but also it's like, right now, do you even feel like, how can I like give you a space where, they have a moment for themselves because yes, they do need care, provide, they need help with, being able to take care of themselves, but also it's like, just don't forget that they are also a whole individual and they still are like, they're that same person. And I think sometimes there is this, at least that I've seen indirectly where it's like that's still, your friend, that's still your auntie, that's still your sister. And it's like those things that they enjoy and those things that they like don't change. So I think in a way, kind of reminding them or even incorporating that into their, just reminding them, and I don't know, like finding a way to, like you said, to get creative with, the challenge, but not forgetting, aspects of their life and who they are. I don't know. It's important.
I think that's a great point. My great aunt, she had to have surgery a few years ago. And it was like the family just got overwhelmed with all of the decisions that they had to make about things. And then she was just being herself when she's just annoyed with things, which is a little crotchety. And we had to just like, my sister and I were like, okay, what would you like to do today? What would make you feel good? She's like, I want a facial.
There we
She's like,
go.
I want to feel nice. So now, every time I go home, I make sure I like give her like I do like a whole facial. I'll offer to like take her to a spa, but she just likes having it done at home. So like it can be fun and relaxing for both the caregiver and the loved one to just do something that like brings them back to who they are. And that's a good point, Brianna, to like when you're caring for someone, make sure that you are like asking them what they would like to do or like do something that they find enjoyable and it'll bring joy to both you as the caregiver and your loved one.
I think that's how you balance that one sense of autonomy that we're playing with here, right? I think that's how you balance out that need and everyone's autonomy here because the caregiver is like, I think I know best, or probably maybe not, but the person dealing with whatever we're talking about, the breast cancer, the what have you, like those moments of realness ground them in the fact that they're not just being taken care of, right? They're not just like someone's doing everything else for them,
Right, not a chore.
Exactly, not a chore. It's like those real sharing those moments. I think it makes it like just a more their humanity is seen. Like what you guys are saying, truly. Um, yeah, no,
Lady, can we hear a little bit more about Black women thriving east of the river just for like the viewers and like the services that you all offer and how you help with like navigating the patient and all of that?
Sure,
totally.
absolutely. So, Black Women Thriving, we are a community-based, community-led organization. And we're kind of newer to the scene. We were established in 2019, but our work really focuses on like two halves. So my half is the patient navigation program, and we have a lot of resources that are on our website that just help women navigate getting a cancer screening or if they've been diagnosed with cancer, getting different types of services, whether it's clinical or medical or support services that help them navigate, their cancer treatment like psychosocial programs and support groups, nutrition education, and food education, and things like that. And then we also have a workforce development program that is led by my colleague, Dewan Mason. And this is more so for women who are interested in entering the healthcare workforce in any capacity. And so we do have a fellowship where individuals can receive fellowship money to go to school or become a certain type of tech to help with screenings, or whether they're, in getting their MD or getting their PhD, or however you are entering the healthcare workforce. We want to support you. And they also offer mentorship and training. So, we kind of take this approach where we want to meet people halfway, answer their questions when it comes to navigating cancer, but also individuals that want to be in spaces where it's important to see people who look like us support that pipeline too. So that's kind of like an overview of what we do. And on any given day, on any given month, you can find me in the community, attending community health fairs, hosting some of our own groups like community conversations where we just bring food and have people have conversations that kind of bring down the barriers between the patient and the provider and answer questions in a very low stakes way so people feel comfortable talking about these things because it's navigating cancer is a pretty difficult topic, and sometimes people are intimidated asking their healthcare professional certain questions. And so this is a space that individuals have enjoyed getting their answers questioned without that pressure of feeling like, oh, they need to get it right, like at this second, at this time. And so that has been really helpful. So, yeah, I mean, I'm happy to answer any other questions, but that's what we do in the community. And, just to kind of bring it back to caretaking and caregiving, like you said, like that is sometimes a full-time job for people that don't get paid for it, it's labor that's essential and needed and important for anyone who is navigating some kind of chronic condition. Doesn't necessarily have to be cancer, but a lot of times caretaking is a lot more, like we said, than just the physical aspects of what someone might need, right? They're still whole people, and we try to make sure that we highlight resources on our website that help support you support someone else. So, yeah.
Yeah,
Yeah, I
the
think that's really important. And like for caregivers, for someone who's recently been diagnosed with breast cancer or other cancer, it is helpful to have a navigator. A lot of systems don't have navigators, in which I think Black Women Thriving East of the River is very helpful for like giving advice or helping to be a sounding board and to navigate the world of breast cancer. And within the healthcare system, a lot of times there are as well nurses who help navigate, which can be a great tool for caregivers because no one expects to get cancer usually. And the navigators can let you know what the next steps are. They can talk with you through questions. They can be with the patient at their appointments as well. So those things are helpful, sort of to offload some of the stress, both for the patient and for the caregiver. So I think it's really helpful to have those sort of things, those opportunities to use those different support services.
and I think that's something, a gap that I think that hopefully today's conversation can close a little bit on like what a caregiver, and some people don't even like that word. Some people like
Yeah.
support team and various things, which I again um call it, find the words that make sense for you. Um but there seems to be a gap in like what, the caregiver knows to ask. Do you know the questions to ask the doctor? Do you know the um just like the side effects of things and therefore what you should be worried about and various things like that. So if anyone can speak to that, I think Lady, maybe your patient bill of rights could speak to that a little bit. And then obviously Bree, your experience in hospitals as well as Dr. Candace. But yeah, I would love to hear about how can we as caretakers learn what we need to know to be the best caretakers. And I also, by that mean know when we don't know and make different choices then as well.
Yeah, absolutely. I think the biggest thing that I can say towards that for caretakers is don't be shy or afraid to ask questions. Really get that clarity while you are in these spaces with medical professionals or even with the person that you are caretaking for, even for yourself. Like it is really, your responsibility to make sure that you understand everything that is related to your health. We've spoken with so many women, unfortunately, that just say, I had no idea what my doctor was talking about when I left the doctor's office. And I just followed up with a family friend that I know is in medicine or someone whom I trust who maybe is a nurse or a tech. I followed up with them after my appointment to kind of figure out what the doctor was saying. And so,
I'll even feel like I do know what they're talking about when I'm there, and then I leave and it just like escapes. You know what I
yeah,
mean? It wouldn't even be like I'm lost on the. I'll be following, and then
same.
I leave and I'm like lost all of that.
Same. Yeah, we've definitely heard it all. And so like just thinking about our patient bill of rights, which is one of our resources on our website, this is kind of like a roadmap that women use to figure out like, okay, I need to plan for my doctor's appointment. I can sit down with my caretaker or whomever, and we can plan questions that we'll have, for the doctor. What should we be asking? Who should we be talking to? It has tips on how to talk with your families and caretakers about certain things that may come up in your treatment, and just things that you should be keeping top of mind. And so a lot of women have found a lot of success using it as a roadmap to figure out, okay, I'm at this stage, I'm going for a screening. What do I need to talk with my doctor about? What do I need to go and speak with my family about? What kind of screening should I be having? What are certain things that may run in the family that I don't know about that we should be screening for now? And just to kind of touch on what you said earlier, Haley, like women are getting diagnosed with breast cancer earlier and earlier. And in terms of, what is clinically kind of accepted for breast cancer screenings, usually women are not encouraged to get that until they're 40,
Hmm.
right? And a lot of times, younger women like myself will be kind of dismissive to certain things because they're like, oh, it's not time yet. Oh, I'm too young. Oh, that might be something else. But even sharing my own personal story, I had my first mammogram last year and I am 30. So I'm about 10 years too early, but I knew I wanted to get it because I'm like, something doesn't feel right. My grandmother had breast cancer, and so that was something that I had to ask my doctor for and have a very like specific conversation with them to say, look, I'm a little early, but here's what's happening. And because I was able to have that conversation with my doctor, I was able to get a mammogram, even if it's early. So, just the importance of having a document like the patient bill of rights to talk about what should you be thinking about in terms of your body if there's changes. Don't be afraid to ask the doctor about, hey, I'm having some pain. What do you think about this? And then be your own best advocate because navigating the system is not easy. I actually learned that I had to call the radiologist's office myself to set up some testing. And I thought that a lot of that stuff would fall on the doctor's office, but it actually falls to the patient to kind of navigate that. So having something like the patient bill of rights kind of gives people a framework to work with to know, what they need to be asking, when they need to be asking it, and people have just found it really helpful.
Yeah, I just put your website on the Black Doctor Facebook so everyone has access to this and you can kind of see some resources, the resources that ladies talking about. Again, I feel like, if we are equipped with the tools that we need to have these conversations, it'll be a lot easier to be caretakers in our family, but also you'll feel like you're actually like doing the right thing or like doing what's best for them. Uh, but yeah. So thank you, lady. I think the patient bill of rights is a great way. And I guess what you're like, here, I might even just quickly share my screen and kind of show, I think this tool here, her patient navigation site. Let's quickly just make a new tab to not show how bad of a tab hoarder I am. Um, but here's like, a quick example of their cancer
Oh, wow.
navigation map and how you can kind of, go through this. I love this resource. I think it's great. And I think that it, kind of matches our community, what we want to see. We want to be able to see ourselves in this work. And so, um, again, hit up um, Black Women Diving East of the River if you want to learn more and dive more into these resources. But it's a great resource. This is literally when I met Lady and I saw this work then. And so it was just something that I know we had to share because I think that it will allow things that are for patients are also for caregivers, right? Like it is going to help
Hmm.
us so much more understand what how to be supportive. Right. So again, it's in the chat for everyone watching. So please take a look and um, understand how to advocate for yourself. Right.
Yeah. I wanted to mention something else, Haley, because you mentioned that caregivers, like as caregivers, one can feel like maybe you're not making the right decision or you're concerned about that. And it's just being there for your loved one um, is more than a lot of people do at baseline. And just to point out again that there are resources to help caregivers. Um, especially when going through difficult times like this. The hospital or wherever your loved one is being treated should as well have resources for that. And it's okay always to reach out to those resources or to other loved ones and say, hey, I need to take time for myself. You can't always be the go-to person for everything. So I think that's always something that's really important for caregivers as well.
No, I agree with that, especially delegating, because
Yeah.
if you do, like my mom has three other siblings and most of them live in Georgia. And so, but my aunt is a physician in the family, so she's really just she's just, she knows how to work the system, but she also is familiar with what things need to be taken care of immediately versus what can wait. And so, you
Mhm.
know, she's had to now learn, as my mom and her brothers are like, you have to let us know. Like we can like all you could have said, all you need to say was, I need you here at this time. We're there. And so now it's so great to see how she's like, well, I know you guys have kids and all this stuff, yada yada yada, because she doesn't have kids, and it's just like, just let us know. And so now it's so great to speaking with her, just seeing how there is a balance now, and it's just, it really, I think it's improved also their relationship and has improved, like, Granny, she now, you know, she can see she has different options, but also she doesn't feel like, oh, I'm putting it all on one sibling or one child. And so I think that's important. And especially when it goes back to resources, I pride myself in really understanding how healthcare is financed and understanding health insurance and like understanding kind of like the whole patient experience from before, like from the front and from the back. And so myself, I do have Medicaid, and most of the patients that we're dealing with at Howard University Hospital do have Medicaid as well. So I honestly, I learned so much just by, I kind of have created in my way like a little, not a roadmap, but there's just some, a cheat sheet. So when they do go in and, say they're getting care elsewhere, or if they need help with, getting, services for, maybe they have arthritis and they want to join, they have different physical therapy that is offered that they don't have to pay, and also that's in their neighborhood that's close for them. And so for me, I try to help patients take advantage of what is given to them. And I really emphasize, you know, at that visit, like make sure, you just don't, especially with like when they have medical students in the room, like we can also be that advocate, because let's be real, time is important. And, I can spend more time with a patient, say, than one of the residents or the attendings at that time. So I just try to utilize what knowledge I have with um, health insurance and just how healthcare works, and to try to just give them some tips, because I'm still learning myself as being a patient and learning about, oh wow, how to ask the right question, or what's the word I need to use in order to get this new follow-up visit. Like it's kind of wild. So I can only imagine a caregiver who might not be familiar with how to navigate that. And that's another stressor too. So I just try to just be a liaison as much as I can.
Haley, you're muted.
Got in over here. Didn't want you guys to hear the screaming baby. Somebody come save my husband. Um, but no, there's the whole piece about there's we mentioned like a physical toll, a mental component, and then there's just like the paperwork, the time it takes to manage the insurance and the things. And keeping records of all the care.
Right, right.
There's a whole, which like, again, is a time component as well as a mental component if you like aren't great at those things, which I know like I admit that like for example, like, don't tell my husband. Um, but no, I mean like insurance is like, oh, you get a free breast pump, right? For after you have like before you get to have the baby. And best believe I went through 15 people on the phone, blah blah blah, and gave up. Like I was like, I'm gonna buy the breast pump. I'm not wait, like, you know what I'm saying? And so like that's the reality of dealing with insurance and things like that, right? And again, I'm talking about something that like was, a cost that like was feasible for me. What if it's not? Right? What if I'm talking about like the cost of a surgery or the cost of a thing that like isn't something I can pull out of my pocket, right? And so you have to wait on those 15 people. You have to have those conversations. And the person maybe you're caring for is like that's the last thing you want them to deal with, right? Is that kind of bureaucracy. And so again, I feel like, and it's making me think right now, I think that the thing that caregiving, because Dr. Cancer, it was a great and beautiful point to think about like how just being there is a lot, you know? So I feel like you do have to think about what's my expertise and how can I add to this person's experience, right? Because it's like if I know, like I'm clearly not the one to call insurance. My sister, on the other hand, probably is much better at that, right? And so it's like maybe I'm the one that like takes mom out to go shopping. You know what I mean? Like maybe like that sounds much more fun than the other thing, but you know what I mean? Like, I think you do have to use your expertise, right? And try to think about like, oh, maybe I'm well suited to do this for this person, so I rather do that. Because then caretaking again becomes not something that becomes stressful for you, but instead just something you already do for that person. Maybe you amplify it this month or whatever, do
Hmm.
more. But like that way you're not taking on something new and it's not a stressor to you. But Brie, I'm glad you brought up the part about like asking for help because because that's a really big part of this on all different sides. The caregiver needs to ask for help because it's more than one person's job. The person who is unfortunately sick or dealing with some ailment, they're not feeling like they're not wanting to ask for help because they already feel so vulnerable, so out of their body, right? And so like there's so many components why again everybody needs to ask for help and everyone's afraid to because they know everybody needs to ask for help. And so it's such an interesting thing, but I think again if you say I'm good at this thing. I'm going to do this thing and ask for help where I'm not good, turns out probably somebody else is doing that is they can offer that thing you're lacking. Like for
Yeah.
example, this is a bad analogy but you'll get what I'm saying, but like I love eating Skittles with my sister because we like the opposite colors. You know what I
Yeah,
mean? It's
exactly.
that exact analogy of just like we like she likes yellow and orange and I'm like gross. Like you know, like give me the red and purple. So like I feel like often when we find ourselves like we forget we if we ask for help, we will find that somebody has a thing that we don't have.
Yeah. I completely agree. I'm a yellow and orange person, and my sister
Oh
Yo,
shares
that's
something.
crazy.
But to piggyback off of that, like let's say like you need help with in the kitchen and like you know that like your
Yes.
other family member or like someone from church loves to cook and like that's an opportunity to incorporate that into what you're doing for caregiving and not put it all of the onus on yourself. So yes, that was a great analogy, the
good.
Skittles.
I'm glad that worked. But yeah, no, I mean, even Bree the other day was like, I can go sit with grandma in the hospital. Like, that's not a problem for me. Like, in med
Good.
school, anyways, I live in hospitals. Like, why not send me? And so I feel like, again, yeah, you never really know until you ask for help whether or not somebody has the skill set to fill the gap you have, right? And so I think that that's, you know, we've heard many a story about the Black woman struggling here. So we have to work to change this narrative, all of us on this call and every woman that we speak to. We have to continue to encourage this because it is a lot otherwise when you take on too much, and And yeah, the caregiver like often, you know, for those it's affected to the point that like you can't work anymore. That's, you know, so unfortunate. And then for those who are still trying to manage their job, right, and do
Yeah.
this, it's a lot. Um, and so I think that a lot of grace has to be given in this moment for also just the slow release to asking for help or getting better at it, right? But also, like, you know, we have to assume less, I think is what I'm saying. Assume less and ask more, right?
Yeah. And I can't stress enough to ask, like, if your loved one or yourself, if you're diagnosed with breast cancer, it's a very scary time. And when you go to see your surgeon or the medical oncologist, they should have resources that you can tap into within their clinics or within the organization. Like so many times I see patients and I make a point to be like, do you feel like you have enough support, especially if the patient is there by themselves? And I offer the resources we have, make sure they're connected with our nurse navigator and potentially the social worker as well to help with providing resources because a lot of people say they don't need help and then they really actually do need help. And it's okay to say yes when we ask you. We're not judging you. We're not asking you to be nosy as providers. We're asking you so that we can provide you with the help that you need because we realize that this takes a community to help you get better. It's not just me operating and removing the cancer. It's not just you taking the medications afterwards or beforehand. There are a lot of other moving parts. So don't be ashamed when you see your providers to say, yes, I do need resources because we can help with that. It
Yeah.
always frustrates me when people say no, and I'm like, I know that everyone needs help.
I'll even admit that sometimes I'm the person that initially says no, and then like 5 minutes later, I'm just like, oh wait, like, you know, which again, like I know is annoying, but like also like, you know, but it's just hard to, and because I'm programmed to say no at first, right? Like
Mm.
it's like almost like a gut reaction that happens, and then you realize like, oh, I like have no idea where to start, you know,
Yeah.
fixing the thing. And again, especially when it comes to some of the more managerial aspects of caretaking. Like I already know that's not my skill set. And I remember when my mom was sick and I don't remember exactly, but she had to get this shot maybe every day or every couple of days. I think it was Neulasta or something like that. Um, after chemo or whatever. And I remember giving it to her once, maybe twice, my sister and I both. I also remember having our like, you know, family friend nurse, Miss Sabor, um, and give this shot to her many other times. And so I feel like it was when we're like, we realized like this is not for us to do. Let's call the family friend nurse to do this. You know, I can't remember the order at which we attempted these things or why my sister and I were trying at one point, but like, you know, because again, like that wasn't for us. And there was 10 people at our church, including Mr. Board, that could do this, that could support this, right? Um, and so I know, I think you just really got to know what you're capable of and also, you know, ask for help and delegate. I think that a lot of these, we heard a lot of great words here, delegate being one of them, around how to like just share the load or else it does become too much. I mean, I know like my family currently, it's such a blessing. We have like strong 4 generations living, right? So like there's always something to do for somebody, you know, and I see my mom run around as much as she can. And I think that as a family, we could probably do a little bit better about sharing that our needs that we could all be there and didn't always fall on one person, right? Um, and like today, it was just me FaceTiming my grandma for 30 minutes, with the baby. And like that was great. And that's probably something that like
I meant
she,
the world.
yeah, And I mean, mind you, she said, call me with that baby.
Of course.
But you know what I mean? But like I should have maybe just called her to begin with. I should have known that would bring, like bring her a smile today. And so, yeah. So, anyways, thank you guys for an amazing conversation. What are your last thoughts? What's coming up before we close out today? I think that I feel activated personally on what I can do in my family. So I'm wondering, what are your last thoughts, guys?
M- I don't know, like just being grateful for because you said not everyone has like you have a a strong, amazing family, Haley, and you guys show up for each other. And I think just that's a big like just being grateful for like, you know, I can at least call someone. And even, though my family's not here, I know I have like a community and like that. I just have to be, like you said, just more grateful and just like you said, reach out. Just it's a simple, shoot us a simple text, email, who, voice note, whatever. Just, I appreciate you. Just simple. So
For me, it's as we go into the rest of 2026, remember you cannot pour from an empty cup. So really lean on that community, ask for help. And in terms of Black women thriving, we're here to support you.
Yeah, and I would agree with all of that. I think it's really important to really get what the person or the loved one that you're caring for know what they want. We didn't really get to talk about like making like having like an in-depth conversation about that, but really understanding what the person that you're caring for wants at the end of the day. Remember to take care of yourself and as Brianna said, to delegate and use your community so that you can really come to be a caregiver with being like fulfilled yourself.
Yeah, no, I think those are really great points. Like caring for yourself is caregiving to others,
yes,
and that is real. Um, And I think to the point of gratitude, it is about when you're having to do that harder work and dig in that patient bill of rights and understand the process behind the care you're giving, remembering that how grateful you are to have this person and to be in this person's life and how grateful they are to have you in their life too, right? And so I think that's really, really important to think about all the aspects and how I do think that we live to be in relationship with others, right? Like no one lives alone or on this island. That sounds lovely until it really doesn't. 'Cause how are, like we like need that social interaction. And so I think it's important to share. And so how can people find you if they want to learn more information? Lady, if there's an email or something to call or email, not call an email. Yeah, please let us know. Our socials, you want people to follow, let us know.
Yeah, I mean, you can find us on all socials, Black Women Thriving. You can find us there. Our website, you can sign up for our newsletter right on the website. I encourage you to do that to stay in touch. And I'm also on socials, LinkedIn. You can connect with me there. And I go by my name, as it's written here on the screen on LinkedIn. So happy to connect with you there as well.
Awesome. Anybody else have any shameless plugs or what's going on or
I
uh,
don't have socials, but you
well,
can find me
our
on LinkedIn.
graduation will be there.
And then I think next month, will you be at Black Joy, Haley?
Yes.
That's so
Oh,
Black Joy is happening in Oakland, as it does every February. This year it's Sunday, February 23rd, 22nd.
Yeah.
So Haley will be there. I will be there. I think some others from Touch will be there.
Mm.
Um, So come out and support us and support Black Joy.
Yeah, come get some Black breast health information at a really awesome event. Hope to see you there. It's one of my favorites. And yeah, obviously follow, at touchpbca.org. Follow Touch or Love of My Girls. That's GURLS. And thank you to Black Doctor and all of our sponsors for having us on our show today about caregiving and patient rights. These shows can always go on forever. And so, Dr. Candace and I will continue to think about if we can bring this one back into the fold. We have a lot of great topics coming in 2026 on Pink Table Talk. So we'll see you on the last Sunday of every month for Pink Table Talk. Thank you guys for being here, and we'll see you
Thank
guys
you.
later.
Thank you. Bye.
Yeah.
Bye.